Welcome to video 11 for the Safe Recovery Training Program. This is self-learning activity number 2. I'm Terry Haines. The objective of this video is to gain practical experience in using information gathered to assist in information sharing and joint problem solving when delivering the Safe Recovery Program. It's also aimed at learning a base set of questions used when providing the Safe Recovery Program. As I've mentioned in the most recent videos, the Safe Recovery Program, when delivering this program to patients at their bedside, is based on a series of steps, 4 of which are interchangeable at the end of the information gathering phase. This is followed by an information provision and joint problem solving phase. Today we'll be talking a little bit about showing the workbook and reviewing threat appraisal and identifying goals and strategies for the patient. Step number 1. Watch the Safe Recovery video for yourself. Step number 2. Continue the conversation you had with a person you spoke to in the last self-learning activity. If that person is no longer available, find a new person who has mobility impairment but is cognitively intact. Avoid patients with a high fear of falling at this stage. If you need to talk to a new patient, commence a conversation by following the same process as with self-learning activity number 1. If you talk to the same person, you may need to check that they still have some form of mobility impairment. Step number 3. Find out how the patient finds being in hospital. Of course, you may need to prompt to find out how they're coping with having to do things when other people tell them to, and having to rely on hospital staff to perform activities like toileting. Find out how the patient feels about asking for help from hospital staff. Do they feel embarrassed, or are they or that they're being a burden to staff? How long has the patient had to wait when they have asked for help for that help to arrive? Step 4. Show the patient the Safe Recovery video. Step 5. After watching the video, ask the patient how watching the video made them feel. Has it changed how they feel about whether they will fall while in hospital? Or has it changed their thoughts about if they were to fall, that hypothetical fall we discussed with patients as a part of self-learning activity 1? Has it changed where or when the fall might be likely to occur, or what they might be trying to do when they fall? Then, ask the patient to identify something they can do to stop this fall from occurring. This is not a process that is you telling the patient what you think they should do to stop falling over or to reduce their risk of falling over. This is a process of asking the patient to think about it for themselves and to come up with strategies for themselves that they think will be effective for prevention of falls. Step 7. Set a goal with the patient using the patient goal sheet. For example, a goal that might be set would be to ask for help from the nurse every time I go to the toilet for the next 2 days. Let the patient know that you'll come back in a couple of days to see if they've been able to achieve the goal.